Today on Vital Insights,
I think our hope is that those access challenges are largely solved with things like telehealth, but there's a whole world of opportunity around the connective tissue of telehealth.
Yes.
That I think is kind of the frontier that's ahead of us. It's frankly what we're really excited about.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future. Matt, there's a lot of speculation inside the health technology space about what impact the pandemic will ultimately have on healthcare. And while I think it's always hard to prognosticate on what will come, we may be able to use learnings from this past year and a half to have a better feel for where we're ultimately going. So can you share what you feel like the pandemic exposed in terms of what was maybe lacking in the healthcare system?
Yep, absolutely. Yeah, I think there are so many lessons that we took from the pandemic. I think that there were several problems in the healthcare system that were these kind of vestiges of an old and outdated system that the pandemic really did expose. And some of those, I think, are permanently changed, which I think is sort of optimistic. And so if you think about kind of the way we access the system, the pandemic and kind of our need to shelter in place and to connect virtually, I think really created a significant gap that technology has closed. So the idea of sort of queuing up and waiting for a doctor's appointment or going to the lobby of a hospital or going to the ER for certain things that are sometimes avoidable and often don't require those kinds of visits, I think are unacceptable to most people in the future. And additionally, the idea that the way that we collect information about ourselves and our health and the way that we convey that information to our care providers, I think has also changed. So the idea that a person is going to live their life and maintain their health and then only occasionally visit a care provider when they're sick or when they have some negative trend towards some exacerbation in a chronic condition, I think is hopefully a thing of the past. So we're paying more attention to our health because we have to.
Yep.
And we expect that part of that is that we can share that information with our care providers in a simple and efficient way, in the same way that we would share that information with our loved ones. And so I think our hope is that those access challenges are largely solved with things like telehealth, but there's a whole world of opportunity around the connective tissue of telehealth.
Yes.
That I think is kind of the frontier that's ahead of us. It's frankly what we're really excited about.
So moving into that kind of hopefully soon post-pandemic space, what do you foresee as things that will stick?
Yeah. So there's so many changes, but I think one thing that's certainly irrefutably sticky is that we've kind of disintermediated the old systems of care. So it used to be such that if you wanted to see your doctor, you scheduled an appointment, and then some period of time later, I don't know if it's a couple days, a couple of weeks, depending on where on the planet you are, you went and visited your healthcare provider. And now that seems crazy, right? The idea that if we need care urgently, that we would wait a few weeks is I think unacceptable to most people.
Yeah, absolutely.
And so that's been, I think, telehealth, kind of the ability to connect directly with providers instantly or pretty quickly has kind of disintermediated the office visit, which raises a lot of questions about continuity of care, sort of who's responsible for the care of a person over some period of time. And those are I think, kind of the really interesting post-pandemic problems to solve.
Yes, absolutely.
This longitudinal question, right? So if we're not only going to our primary care doc every so often when we have an exacerbation with a condition or we're sick, then how do we manage that care over time? Who pays attention to it and when and why? And those are really important next questions, I think, that we'll start working on next.
So when we think about the explosion of telehealth, because we've seen that during COVID, that was, it was irrefutable. when I imagine telehealth, I do see some holes in it. Mm-hmm. How do you think we'll address those holes, those kind of gaps in care that occur naturally with telehealth, even with telehealth?
Right.
How do you see us addressing those?
Yeah. It's an interesting question, right? So we can't only look to telehealth to disintermediate the office visit, right? Because that creates some yield, some benefit for the patient/consumer, but it's limited. So really, the earliest instances of telehealth that were some sort of virtual visit between a patient and a provider. So what did that really change? That changed the queuing up, the lobby, the waiting room, the driving to an appointment. So all those are great, right? But in essence, the nature of the visit didn't change. So the patient still presented, described a certain series of problems. The physician responded based on the history, physical, and the presentation, and the other data that they may have. So I think what we're going to see, so that's a challenge, right? So we've created some yield, but not a ton of yield. There's really not a big difference in efficiency because a physician can still only see a certain number of patients in a day.
Yes,
so
absolutely.
we kind of cleaned up the front end with technology, but we didn't really change the model. And so I think the problem of efficiency and throughput says, how can we use technology through connected sensors, easier to access lab tests, and other kind of things that used to be complex and difficult? How can we use those technologies to help identify which patients are trending towards an exacerbation so that we can identify them and queue them up differently, perhaps even earlier, so that we can, instead of just cleaning up the bunching up in the lobby or the waiting room, that we can actually create some efficiencies in the process so we can see smarter, more effective patient queues and more efficiency within the GP's office kind of generally.
Well, and that leads very perfectly into my wrap-up question, which is, as we find ourselves still battling COVID-19, what technology solutions do you think we'll see become even more firmly entrenched in the next 12 to 18 months?
Right. Yeah. So I mean, I think that when we think about the ability to access a virtual care system, the infrastructure for this is largely in place. Most people in the States have, through their care provider, their health plan, or their employer, they have access to some sort of connected care. I think that the next iteration on this is the technology that allows us to gather valuable information about ourselves and share that information with the care providers. And so sort of step one was to disintermediate the office visit, to connect us virtually. And then step two is to add some richness to the interaction. So we're not just providing kind of a verbal description of our symptoms, but we're coming with data. And in fact, it's quite possible, and I think necessary, that not only are we coming with data, but that data is informing when and how we interact with our care providers. So, I mean, I can sort of see a world where, as people were generating data all the time, these sensors that are now really accessible and inexpensive allow us to start to aggregate that data and study it, perhaps, or just observe it passively, but then share that information continuously with our care providers so that occasionally we can tap them on the shoulder and say, hey, I'm not feeling so great, maybe we could have a visit. And occasionally they can tap us on the shoulder and say, hey, something that we're seeing in your data about yourself is concerning to us. And so we'd like to initiate a visit. And so I think that's the real kind of spring forward in efficiency that we're all looking for. And I think in a world where we can all have a virus that's wildly contagious and scary to all of us, I think everyone's sort of willing to get in the boat and row together to say, yeah, let's start paying attention and let's be more proactive about our health than we have in the past.
That's fantastic. Well, thank you so much for joining us today.